I'm Jerry King from Jerry King's Training. You're watching From the Ground Up. What we want to talk about today is stud colts, castrating stud colts, the importance of castrating colts. A lot of people, they want to wait too long on a colt. They want to let him, they think they're going to muscle him up and grow a big jaw on him, and then they're going to castrate him. They figure they have a better looking horse. But what they don't understand is when you castrate a colt, unless you wait till he's 12, 14-year-old, you're going to lose all of the stud characteristics. You're going to lose the jaw and the things, and the colt will actually grow better as a gelding than he will as a stallion. But so many people, they say, well, I want to keep my colt a stud, and I got a mare I want to breed to him, and then after I breed them to this one mare, then I'm going to castrate him. There's some great stallions that's won hundreds of thousands of dollars that you can breed for very, very low price, and it's not worth the training, that is extra training it's going to cost you. It takes so much longer to train a stud horse. We work a lot of them here, and we have no problem working stud horses, but it takes longer for them because they can't keep their mind focused. And if you're going to castrate him anyhow, if you're thinking about it, castrate him at a young age, because the younger you castrate him, the more of a gelding. My colts, I try to castrate them all at 11 months before they come a year. Because if I'm going to have a gelding, I want 100% gelding. I want his mind to be completely a gelding before he starts realizing he's a stallion. Because some of those things never leave. They'll keep some of the fighting other horses or nickering other horses, teasing up mares and stuff like that. They'll keep that the rest of their life if you wait too long. Especially if you're going to breed him a time or two and then castrate him. Those thoughts never leave their head sometimes. So I really promote castrating them at a young age so that you have a safe horse. It's much safer for the public and for you riding, and a much happier horse. Stud horses that are not into a steady breeding program are very unhappy horses. We get them here, and I've had them that just kind of wanted to bounce off the wall all day. You could tell that his mind was going 90 miles an hour all day. They're very unhappy because they see these other horses all day and their hormones get to building, and they can't help it. It's things they can't help it. Now, you do have some stallions that are good-minded. We've got a stallion here that we stand at stud that is very good-minded. It doesn't bother him. He gets out, does his work every day, and he doesn't have any issues. Stallions like that are the stallions that need to be left to stud. The ones that are screaming and hollering all day and pacing the stall, they're just so unhappy. It takes more to feed them. They lose weight because of it. They're dangerous for you to try to handle, to try to ride around other horses. So if you want to be happy and you want your horse to be happy, castrate them while they're young, because it does make a lot of difference. I had a gentleman one time that had a stud here that was wanted me to put shoes on his front end because he was rearing up. So he called me the next day and wanted to know what I thought. I said, well, you got the right idea. Your horse is unbalanced, but he doesn't need shoes on his front. He needs castration. If you'll lighten his back end up, his front end won't come up so much. So, but he didn't quite understand to start with, but he finally, after a few days, he finally understood what I was talking about. And we castrated him, made a gelding out of him. Everything went well, and much better horse, much happier horse. And he was able to go on and enjoy him instead of fight with him. Studs, you got to keep them in separate lots. You got to keep them away from other horses so that they don't tease and get rank and hurt someone. So it's much better off. There's way too many good studs out there that someone else has that you can breed for $500 to $1,000. There's studs that's won $200,000 or $300,000 that you can breed to for $1,000, $1,500, and it's not worth it for the general public. So that's what I want to talk about today, was promotion of trying to castrate our stud horses. We're fixing to do this colt here today. The customers that own it, they were thinking about it down the road, and after talking to them some, they decided to let's go ahead and save a lot of trouble and save money and go ahead and castrate him now instead of waiting. So that's what we're going to do here today. We do a lot of them here. A lot of people are worried about when you send a horse to a trainer that when you castrate them, they're going to be off training, but that's the last thing you want to do. When we cut a horse, we give him 24 hours to stand in the stall to let all of the blood vessels clot, and then after 24 hours, we get him out and start working him, and we work him every day until he's healed. It keeps the horse from swelling and makes the heal process so much better, less likely of infection because he's not swelling, he's not closing up, he's able to drain. Because if he's not moving around, he'll close up too soon, and it'll start swelling. That's where you get some infection. Some people worry about castrating the horse. They say, well, he won't be worth as much as a gelding. But the problem is, a stallion, especially a stallion that has hormones are pretty high, there's only a small number of people that are able to handle a horse like that. So your market is small. But if you castrate them and have a gelding, then your market opens up. It's 10, 20 times more valuable to different people. So your sale market is much wider if you castrate them so anybody can handle them. Hi, I'm Jerry King. This is Dr. Brian Garrett. He's here with us today to castrate a stud colt, 2-year-old stud colt. And what I'd like for him to do is to explain to us why the importance, from a veterinarian sense, why it's important to cut these stud colts at such a young age.
Very good. Yeah, well, so ideally I prefer to cut them at least as a 2-year-old or younger, and the main reason is because they do such a better job at post-operative healing. It's easier on them mentally, it's easier on them physically. They do not have quite the swelling, the bleeding, or nearly the complications that you would expect for some surgeries to incur. So also they just seem to, the pain level is much less. Some of these young horses barely recognize the fact that they have had a surgical operation, even a minor surgical operation. And then they become much better geldings in the long run before they are allowed to build up enough testosterone in their system to realize they're stallions, which can kind of change their attitude quite a bit as they move on and have both around their 3-year-old year and older. So castrating older horses can lead to some more complications you have to be concerned about. Typically, again, a lot of bleeding can lead to a lot of swelling. And these horses usually require a little bit of anti-inflammatories. They get a little uncomfortable. They require a lot more exercise, just a lot more aftercare in order for them to stop bleeding, one, and two, I like for them to swell just a little bit. And then later on, we want to bring the swelling down. So the next day, after 24 hours in the stall, we start getting them out and exercise them a little bit. Older horses, when you castrate them, especially if they've been bred and they're confined for 24 hours, they need to be comfortable with being in the stall. I think that's really important, because if a horse is used to being out in the field or around other horses and they're nervous in the stall, and you castrate them, you throw them in the stall for 24 hours, they're going to be more active than they should be. And that could again lead to more bleeding, but even worse, could possibly lead to a dehiscence or a herniation of the intestines through the inguinal rings. Because you remember, when you do a field castration, these horses are left open to drain and heal. They are not sutured. If you suture them shut out in the field, they will cause a lot of complications and be infected. But it's an open area into their abdomen. If they get too active, especially in the first couple days, they could herniate out, and that usually ends up in euthanasia or even or death. So it's not just a simple minor procedure that should be taken cavalier. You just need to be able to pay attention and be able to work with these horses and be on top of any post-operative complications that may arise. So these, again, the younger horses, it's a little easier. It's an easier surgery, and they recover nicely. So typically nicely. They can have complications as well, but it seems to be less complications than some of these older horses. So
you cut one for us about 2 weeks ago.
Yep.
I believe it was a yearling, a long yearling.
Yep.
And we castrated him, and we kept him in the stall for 24 hours.
Yep.
We turned him out in the pasture with another gelding that had a little movement to him, and we've checked on him every day since we castrated. We've not seen any swelling. He looked like he was never had a surgery. Right. And that was a good example of castrating a young horse.
Yes.
That he was able to get out and exercise and didn't swell, and it was very easy on him. He never was sore. He never moved around sore. He never limped around. I mean, the surgery was just really a piece of cake for him. Yeah. Tell them the importance of castrating them on site versus castrating them and then putting them in a trailer and trying to haul them immediately after you do the surgery.
Yeah, I personally am dead against immediately hauling the horse after a surgery. I think they need to stay put for a day or two. Whether they're hauled into a veterinary facility to be castrated is fine, or they need to be comfortable with the facility they're at when they're castrated. When taking these horses and just immediately put them on a trailer, I think that really increases your level of complications. You're asking for some potential problems. And I have clients request that I do that, but I don't think that's the best option for the horse. I think they just need to stay put and stay still for a few days because there's a lot of things that can happen in the travel. Not only are they constantly moving, they're nervous, their blood pressure changes, their heart rate's up. Again, you can, they may have completely stopped bleeding by the time you put them on the trailer, but because all the activity and the excitement, they can really increase, that hemorrhaging while on the trailer to wherever they have to go. And then another, and this has happened, I've heard of these scenarios in the past, where someone is pulled out in front of a horse trailer. And the person driving the trailer had to slam on brakes, of course, which threw their horse down on the ground that had had a castration in the past. And they open up the trailer door and the horse's intestines are all over the trailer. So it's just best not to, I think it's best not to move the horse that soon after a surgery like that. So, but there is an option for older horses that I always give these clients that these horses are older stallions that have large testicles. I still think the best way to handle it is to do what's called a primary closure castration. That does require a little bit more work. That requires anesthesia on the surgery table, but everything is done sterilely. The scrotum's removed, the testicles are removed, everything's sutured up nice and pretty. The horses look like a gelding when they get off the table. They heal extremely well. They're in less pain. It's less invasive as far as less care. And you don't have the risk of the bleeding. You don't really have the risk of the herniation because you close the rings, these inguinal rings, while they're on the surgery table to prevent herniation. When they get off the ground or get off the table, and over the next few days while they're trying to heal. Those horses that I've seen, and we have done those surgeries in the past, do really, really well. And I always try to advise the owner that that is an option. It is more costly than just a field castration, but it is quite a lot less care associated with it as well, and much easier on these older stallions. So
let's get this 2-year-old here and
all right.
get him laid down and get him going.
All right, sounds good.
Okay, we're here with our 2-year-old. I got Dr. Brian Garrett here. We've given him his first shot to relax him. Now this second shot, when your vet goes to give this second shot, the person that's holding it really needs to be cautious because more accidents happen when this second needle goes into him because they're kind of off in la-la land a little bit. So always be sure and hold the horse good for your vet so that he doesn't get it.
Well, the most important thing is to manage their head. So you want to make sure that you can use their head to help them go down a certain way. Because one of the most dangerous parts about the whole procedure is getting them down when you lay them on the ground and getting them up, because that's how they can hurt themselves. And when they're getting up, they're still under anesthesia, so the world's a little spinning around to them. They're kind of dizzy, and they can certainly lose their balance and go back down. So you have to be really careful and stabilize them when they get up off the ground as well, so they don't fall and hurt themselves. So we'll do that, and we'll go ahead and give him a shot. It's called an induction shot, which gives him a little anesthesia to go ahead and relax him, and he'll lay down for us. So.
Takes just a few seconds for this to take effect. See how I just kind of lowered his head down so that when he did lay down, his head didn't have far to fall. He was already down. So I waited for that to take effect.
Now they're very sensitive to stimulus under some of these drugs, as far as they're still able to hear everything that's going on. And you want to kind of be quiet during the procedure as much as possible so you don't excite them, because you don't want to get them too excited when you want to get up earlier than necessary. The longer they stay down after this, the easier they will recover. So we're going to cover his eyes so he can't see a lot of what's going on. So, all right, we got both testicles down.
We do probably 1 or 2 of these a month here with horses that come in for training. I really recommend people, if they want to do it, let us do it here, because we're going to be out here monitor them all day, so after surgery and all, we know what they're doing and how they're doing and everything. And I always come out late at night before I go to bed and check on everybody. Also live right here close by, so that if a horse gets cast or something during the night, it makes it, I can hear them slamming on the walls and I can come out and check on them. So those things makes it real handy when you, especially when you're doing stuff like this to horses, that you're always close by.
Clean him off, clean the area good. Now, I have a preference to block the area, do a little local block. It's not the preference of everyone that does this procedure. I like it because it they don't feel as much. If they don't feel as much, they're a little calmer during the procedure, not try to get up quite as fast, because I think the key to successful recovery is a slow recovery from the anesthesia. So doing a little line block where I'm going to make my incision. Also block the testicles and the stump. And that is it. All right, we'll begin our incision. Scalpel blade.
Brian's been doing this for me for I don't know how many years. I think his father also does this. I think I started using him close to 40 years ago, in the upper 30s anyhow.
All right. There's also several ways to do this procedure as far as how the horse is laying. Some people like to do it up on their back. This is developed to be the best way for me and safest for the horse in case they try to recover quickly. They have a hard time getting up with their top leg retracted. So we're going to put the clamp on what's called the pampiniform plexus, which contains all the vessels. This is the most important, one of the most important parts about the procedure. This clamp needs to stay on. I try to keep it on as long as possible. A younger horse, probably a minute. An older horse, a minute and a half. And this is where I get a little concerned. Do not want to get in a hurry. You want to work at a steady pace, but you don't want to be in a hurry and just clamp these, cut them, and go. So the clamp clamps the vessels and crushes those vessels so they will not hemorrhage, and you'll have very little bleeding. As long as it stays on there for a minute in a young horse, you should be fine, but just clamping it, cutting and go, trying to get through the procedure as fast as possible, it's not always the best way to go. So you want to work steady, but you want to, not get in a hurry either. And then this last piece, part of the cord here, this is what some people, if you don't get enough of it, would be what's called the squealer. If you leave it just a little bit down by the tip, where the head of the epididymis is, then you'll end up with a horse what's called prow cut. It can produce just enough testosterone, that little piece, if you leave just a little bit of it, just a slither, to have a horse to continue to act like a stud most of its life.
He's not able to breed, but he's still a study.
Right. So I like to leave that on until I get the other testicle out. All right.
This is the best money you'll ever spend on your young horse, I promise you. I've seen many, many one of them done.
There we go.
The most we've ever castrated here at one time, I think we've cut seven. 2 different times we cut 7 stud colts at one time.
Okay, that clamp's been on there at least a minute plus. I'll grab the other part of the testicle. This is a much smaller testicle. It's not been down quite as long out of the external ring. The ring is the...
Hey, my name is Daniel Rayner. Numerous time qualifier to the Southern Finals Rodeo, won team ropings across the country. I've used Mule City feeds since I was a kid. Always great quality feed. And I use complete horse feed. It already has hay in it. If you're tired of chasing hay, then give Paul Dunn a call today at Mule City Feeds. I thank him for all the effort and time he puts into quality feed.
This is a son of one-time Pepto out of a full sister to Like a Diamond. He's a paint stud horse that's standing in the stud here. We've started his 2-year-olds this year, and I really like what I've seen out of them, their athletic ability, their stopping, their mind. They're good minded, and so is he. He's been so good to train and show and had a lot of success with him. We've collected on him. His semen is really good. It ships well. So if you're looking for a stallion to breed to, this would be a good prospect to do. He's a real athletic and good-minded colt.
Good. Let that sit on there another minute.
And it's important that you get both of them when you go in there. If one of them's not down, it's a whole different surgery that you have to do in order to get the one that's up in his body.
Correct. If both testicles have not descended down past the inguinal rings into the scrotum, then you're dealing with a horse called a crypt orchid, and that requires a little bit more extensive surgery, usually in a surgical facility on the surgery table. Those testicles can be anywhere from just inside the inguinal rings or all the way into the abdomen, which often requires an abdominal incision.
And actually, it's more important to get those, castrate those type horses than it is a normal type.
Right, they'll get a little studdier quicker. Those testicles remain in the abdomen, and then of course the horses at an increased risk for testicular cancer with those retained testicles. So I'm going to open up the scrotum a little bit. We've got it open. The main thing is I want to open up so we increase drainage. So I'm going to split it just a little bit right down the area where I numbed it so you didn't feel that, although it looks painful. And then I will take out a little bit of the center tissue here just to open up that area, again to increase drainage, which will decrease the risk of infection and increases a successful healing and post-castration recovery. So that amount of blood is perfectly normal. That's okay. I always kind of go down and look back, way back in the scrotum, make sure I don't have a large pooling of blood that would look abnormal to me. If that is the case, sometimes that one of those clamped vessels may not have been crushed very well. I'll go back in and try to find it and crush it or even do a ligature. But on this horse, there's no pooling of blood, and that's actually a normal discharge there. So that's it. We're good to go. What we're going to do now is release him. This is, again, was in a slip knot, so if you get in trouble and the horse tries to recover too quickly or come out of anesthesia too quickly, you can just open up that slip knot, let the horse go, and he can jump up if that's what happens. There are cases where these horses try to recover too quickly, and some of that has to do, some of them can move through the anesthesia quicker than others. But a lot of it has to do with the kind of excitement they have when they go under the anesthesia. So it's really important, again, that the horse is calm when you give them the sedation, because if not, and their heart rate's elevated and they're really excited and their adrenaline's rushing, they're going to have a harder time becoming anesthetized and staying anesthetized during a procedure like this. Just another consideration I have when I go to castrate these horses. I want to make sure they're in everything is, realize what's going on, they stay nice and calm.
And we don't want to, when we have one, like, we don't want to try to rush him up either. We want to try to let him lay there, right?
The longer they stay down, for me, the better. If they're going to stay down an hour, I'd love to. It doesn't matter to me. I'm not going to be in a hurry to get them to come up. It's
a little safer getting up and everything if he's the longer he lays there, gets waking up.
That's right.
Right.
Yeah.
So we'll just let him lay here, and we'll keep his eyes covered till he gets ready to start to get up. And when he starts trying to get up, then we'll remove the cover from his eyes, and someone will hold the rope and help him, assist him in case he's a little wobbly trying to get up. We will assist him, and to be sure his getting up is as safe as his laying down was, less injury.
We continue to monitor the breathing. He's breathing well. Watch his gum, which I can see his gum color for him. From here, his gum still staying nice and pink, so we've got good circulation still. And this is a good time to ask where the horse is on his vaccine schedule. Right. These horses need to be up to date on their tetanus when they're vaccinated, when they're castrated. So this would be a good time to vaccinate them if they're overdue or have not been vaccinated previously. And it's also a great time to check for wolf teeth. These horses have wolf teeth while they're under. It's a nice time to get them out. Just coming through on the other side.
The other one should be too.
It's almost through.
Yeah. So is he okay to do that? Take them out now? Would you take them out while we're down, or would you wait a little longer?
Wait a little longer on the opposite one because it's just budding through.
Right.
But
okay.
One, the first one is ready to come out.
All right. What these little teeth here, if you don't remove them, sometimes it interferes with your bridle. When you start bitting them up. Right now, this colt, we don't have a bit in his mouth yet. We're still just using a nose band on him, but when we start bridling him up, the little tooth right there will hit the bit where you can see it or not, and it'll cause he'll go to flipping his head. Sometimes you see a horse that wants to flip his head a lot. If you'll check, his wolf teeth haven't been pulled out. That'll cause him trouble. So we try to go ahead and pull them out.
He's got one that came through well on this side, but the other one is just barely poking through the skin. It needs just a little bit more.
So we're going to wait a little bit on him and let them both come through and take them both out at one time. So instead of having to go through two different deals, we'll just give him a little more time. Well, I want to thank you for watching our program today from the ground up. We've enjoyed it, doing it, and I hope you've enjoyed learning a little something. We always try to give you information try to make you a better horse and a safer life for you and your horse both. So I appreciate you watching, and tune back in for us the next show. Thank you.